Now, I have a feeling this conversation is going to affect and connect to a lot of us right now. If you've ever wondered how your neck pain is related to your stress levels, because there always seems to be a correlation, or why that last workout session left your tendons crying for help, well, you're in for a treat. Today, we are talking with Dr. Hilton Lazar, a chiropractor who's all about a holistic approach to muscular-skeletal health. And then, of course, we've got our friend Laura Johnston, CEO of Phytoceutics, who also happens to be an integrative nutritional health coach, to have a very interesting discussion. Doctor, I'm going to start with you because this is a term that's difficult enough to say, let alone to broach. Neuromuscular-skeletal therapy. Okay, I haven't ever said that on air before, which is very exciting to me. But this speaks to a different approach to certainly chiropractic work. So maybe you can fill us in on your approach.
So my approach is an evidence-based approach, and it's driven via a model which became more apparent to me actually during the pandemic. So It's a biopsychosocial model. And even though my work is primarily hands-on, listening to what patients are talking about oftentimes uncovers the fact that sometimes things are structural, but the underlying problem is either a habitual problem or a behavioral problem or an environmental problem. Yeah.
And thank you for doing that, because I would imagine you're flying in the face of a lot of what the medical kind of fraternity is pushing a lot of the time. And it's great to see now that baseline is shifting up and that you are representing that. When you talk about the conversations with patients, what are the issues coming in? What are the most common areas of concern? What are your patients worried about?
The biggest presenting complaints are generally neck and lower back pain, and I think that's just by way of me being a spinal spinal person. But I mean, I do also have a special interest in running, so I see a lot of tendon-related injuries, and then the standard stuff: headaches, neck pain. I think a function of sedentary lifestyle, and I think the systems we live and work in are geared for sedentary behavior, where you sit behind a desk if you're a finance person or a professional, and it's long hours. And then on top of that, the way we structure our exercises, we'll sit for 8 hours a day, and then we'll kind of spend an hour doing a high intensity interval workout. And a lot of my understanding of problems in, let's call it, skeletal health is overuse. So an overuse in the spine is a conversation for all in of itself, but that's the model that I think about when I'm treating people.
And bless you for doing that, because I don't think a lot are approaching it from that overarching view. I've watched you emphatically nodding your head throughout everything that's being said. So much of this must make you excited. An overarching holistic view. Is this kind of notion and understanding something that you are coming up with a lot now, or meeting a lot in your space?
Absolutely. And, people always think it's the sexy areas of health that gain the most interest, but bone and joint health comes up over and over again on all of our platforms as a key focus area. And it's exactly what Doc says. So it's, these intense periods of exercise. Often when you live a largely sedentary life, paddle is taking injuries, taking people out with injuries, and I think that's a perfect example.
Yeah, well, I think paddle's the new touch rugby. I think touch rugby and social five-a-side football is what did it for my generation. I'm really interested in the P in BPS, the psycho. Can you elaborate a bit more on that, Doc?
There's an interface between the psycho and your neurology, and that's where that's what they tend to miss, is that just because you're talking about psycho doesn't necessarily mean you can exclude it from your neurological system.
Yeah.
And I think the interfacing is the autonomic nervous system. And when you think about the autonomic nervous system, the best way to think about it is a spectrum. On one end of the spectrum is the sympathetic, fight, flight, or freeze, and on the other end is the rest and digest. And it's not to say that either is good or bad. In the morning when you're waking up and rousing, you want to be more sympathetic.
Two polarities that we need,
You need to be oscillating between the two. Where I think the psycho has a big role is that when you're under duress and you're in that side of the fight, flight, or freeze, the basic physiological outcomes of being in that space. And I'll say this is where it gets a bit more technical. There's a term called interoception, and how you understand your internal environment or your internal world gets heightened. So the best analogy would be, let's just say you had pain, you scored it at 2 out of 10, ordinary day, sitting on a deck chair, at a pool, having a great time, if I had to ask you to rate it, you would rate it at 2 or 3. On a day where you've got lots of deadlines, your kid is teething, you haven't slept, then all of a sudden the rating or the subjective rating of your pain goes up to 8 or 9.
Brilliant.
Pain is firstly a subjective experience, but it's definitely modulated. The intensity or the volume dial is through that autonomic nervous system, and I think that's where a lot of the wellness stuff comes in, the breathing, the meditation.
Don't give it enough credit in what it can do in that space.
Yeah.
How would you inform this from a supplement journey perspective? When you hear a doctor and you want to empower a doctor doing this kind of work, what do you reach for?
Yeah, so I think, you can tackle it from a number of angles. So, just getting the basics right when it comes to bone and joint health is crucial. So vitamin D, K2, magnesium, your B vitamins, omega-3s, all very important, also for muscular health. Then when you're looking at inflammation, which is, chronic with injury.
We've mentioned inflammation in every conversation we have had.
It's so key,
that, Laura,
and this is one of the biggest contributors to disease and pain. And, you have non-steroidal anti-inflammatories like curcumin that are super powerful, and you can take them over an extended period of time, unlike maybe your steroidal anti-inflammatories. And then if you're struggling with stress, an adaptogen like ashwagandha can also help with how your body handles stress, also how your brain handles stress, your cortisol levels. So yeah, look for highly bioavailable products, so biocurcumin, which has exactly a very good absorption of curcumin, and then good doses.
And very good doses. Thank you. I know we had to get quite technical today, so thank you for bringing it down to a level that we can understand. I absolutely love the fact that this is our jumping off point when looking at pain management and treating what might feel like a lot of very complex things, but when we boil it down, so many people are suffering from something similar. So let's hit it and hit it hard, from the importance of staying active but doing it in the safe way to the crucial role of supplements and supplementation when it comes to recovery. We've covered how we can tackle pain from a completely, maybe every angle at the same time. And if you're feeling inspired or maybe just really sore, it might be time to stretch, breathe, and maybe even try a supplement or two that work for you. So if you want to start that journey, you can visit Phytoceutics.com to find the right supplement for you and your phase of your journey.
Optimize your gut health with Phytoceutics' range of pre, pro, and postbiotics. Use code EXPRESSO for 15% off at Phytoceutics.com.